Nails into the brain. What happened? What's up, guys? Real Doctor Jin here, board certified internal medicine. Let's take a look.
Those look like nails.
A trauma case. Nails where? Nails into the brain. That must be a very rare case. What happened to this patient? Let's take a look. Wow.
Can't see my hands.
Got it.
What happened? The patient cannot see his hand. That means maybe the nails already injured the optic nerve in the brain.
He's conscious, but
Breathe
blind.
deeply, George. You won't pass out.
There's 4 milligrams of morphine, titrate up to 10.
That's for the pain
You know what? I
control.
don't want him to move.
I can't see.
It's okay. We need you to be very still, Mr.
Cruz. Jorge Cruz. He tripped and fell down a flight of stairs holding a nail gun.
Oh, this unfortunate guy fell from the stairs and holding a nail gun, then shooting inside the brain. Will he survive?
Now he managed to initiate a blood vessel, not some other miracle.
Optic nerve still infected. You feel this? Numbness on his right side.
Right, checking the sensation.
Right. I want to be pulling these nails out in the next half hour. I need a CT.
CTs are down.
What?
They exchanged them out last night. Computers crashed, having back up by 1.
Typical. So what are the options?
An MRI.
No.
Brilliant. The man's got nails in his head. Let's put him in a giant magnet.
Alex is correct. The patient has metals in the brain, so they can't do the MRI for the patient. So other situation in the clinic, like patient has the pacemaker, has artificial joint, or patient has some surgical staples inside the body, then it's not a good idea to do the MRI.
You want films from 3-axis points in a C arm surgery.
Excellent. You guys dig up research and find out if this has ever happened before. Go.
Wife? My
She's
wife, my
on the
wife.
way. Your wife is on the way, Mr. Cruz.
Stay with it. Keep them calm. And look for changes.
Baby,
Donna.
You are in so much trouble.
It's already a miracle.
Get a history from her before you scream it. Thank you.
will he be able to see again?
We won't know until the nails come out.
That's
He
right.
takes photos. Beautiful photos. It's his hobby.
Jorge said he's been having headaches.
Oh, seems the patient has some headaches before this trauma. Is there any other related history? That is what we always do, need a detailed history of the patient.
Have you seen him having headaches? Can you tell me about them? Have they been recent?
I'm not sure. Maybe the last couple of months?
Have you seen him experience any dizziness or disorientation?
Yeah, that's the way we collect more history
Yes,
from the
yes, I
patient's
have.
family.
Vertiginous or lightheadedness?
Lightheaded. Sometimes he'd have to brace himself to get out of bed.
Right, from a very detailed history, usually you do a differential diagnosis. For this patient has headache, usually we need to know if it's lightheaded or headache and feel dizziness or have the room spinning. If the room spinning, we call it a vertigo.
Could be a million things. Simple orthostasis. What?
What made him fall downstairs with a nail gun?
He said he tripped. Just because you hear hoofbeats, don't assume zebras.
Here, Dr. Gray is thinking about we call it syncope. Sometimes when patient syncopized, you need to find the reason why the patient syncopized. Otherwise, you never know when the patient will have next syncope, when and where. It may put the patient in a very dangerous situation.
Something caused him to lose consciousness and fall down the stairs. He could have a tumor.
Look, I have no idea why this guy's still alive, let alone moving and talking.
Will the patient have a tumor like Dr. Gray suspected?
Not a clue. Let's just get him through this before we start digging around for something else.
She was in a red dress. And there was this field.
Wow, look at the nails. Look at the nails. Look at the nails. Dr. Shepard is going to pull out the nails. How? We'll see.
Has shot 7 nails directly into the skull
7 nails.
without doing significant damage other than the optic nerve, and we may be able to save that. The idea is to remove the nails at exactly the angle they entered.
Right, that's the way cause the least damage.
Any wiggle, and we risk doing more damage than when they went in.
Where are they?
Okay, so they are pulling the nail out. Need to be very steady, the hand. Very steady.
Gel foam.
Gel foam, which is very commonly used in clinic. I have a lot of patients with some finger like peeling off some skin and cannot control the bleeding. I will put some gel foam there and rub it. It will miraculously stop the bleeding.
Good team. Good job, everybody. Thank you. Big question is the optic nerve.
Right, patient can't see.
Did I order the MRI?
Needs to stabilize. We'll do it tomorrow.
Right, because patient is now still high risk. If you have some bleeding inside of the brain, that's a huge complication. So they want patient to be stable for one more day, then check the MRI to see if any other complications inside of the brain or if any tumor like Dr. Gray suspected. We'll see.
Is he awake?
Even better.
Wow, he's better.
Hey, how are you this morning?
Tell them what color my dress is, Jorge.
I'd know the answer to that even if I couldn't see.
Jorge's vision comes back. That is amazing. Good job, Shepard. Neurology exam is very important after surgery. They will check the sensation, check the weakness, and check the reflex.
Can you tell me what you had for breakfast on Monday?
Cheese omelet. And on Sunday. And on Saturday. And on Friday. Someone gets up every morning and makes me a cheese omelet.
It's the only thing he likes.
It's the only thing you know how to cook.
I like this couple.
Okay, well, things look good, but I need Jorge to get an MRI this morning to check for residual bleeding.
Okay, they are doing MRI for the Jorge.
There. It's a tumor.
Right. The patient do have a tumor there. That means the patient, because of the tumor, may be syncopized while walking stairs and then have the nail gun shooting the brain. Look, the tumor over there. It seems Dr. Gray found a zebra this time.
Midline of the hypothalamus.
Will they do the surgery?
Best practice? Probably to remove the tumor. Probably because I can't get it all. 99%, but not all of it.
Right. The doctor always gives the patient the best choice
Radiation and chemo, you're looking at maybe...
and alternative too.
Let's do it.
Patient always have the choice to make a decision for themselves. The doctor just gives the choice. That we call patient-centered care. It seems Dr. Shepard need to cut the surrounding area too, so it will cause a lot of brain tissue loss, and the patient may lose some function or the memory.
Alright, you stand a good chance of losing your memories. Of losing who you are.
Is there any other way?
That's sad.
The alternative is a gamma or cyberknife treatment with focused radiation. It's less invasive, there's a little chance of memory loss or him losing himself, but it would only give Jorge maybe 3 to 5 years.
3 to 5 years.
Wow, that's a very tough situation for them to make the decision. Oh, what's their decision?
Jorge's done with the surgery.
So they prefer the surgery. What will Dr. Gray think about that?
Zona, you need to consider what you'll lose. What good is 5 years if he doesn't joke about your omelets? And he can't remember seeing you in that red dress.
It's still 5 more years.
You don't understand. He'll be there, but he won't be Jorge. He won't even recognize.
This is our business.
It seems to me Dr. Gray did too much this time. Usually we give patient the best choice and alternative. We always respect the patient's choice.
You think that I'm being selfish, that I don't want to give him up.
I don't.
This is Jorge's decision. And if that means 10 bad years for me, fine. I'll give him those years, because I will give him whatever he wants. If he doesn't remember what we are, he's still my Jorge. And I'll remember for us both.
Sometimes we do talk back to the patient when they have the decision, but what we do is not change their decision. What we do is to make sure they understand different choices. Let's cross fingers for Jorge surgery. Look the Jorge. Look the couple.
As long as you can.
Happy ending. I love this story. What about you? Let me review the whole story in a timeline with you. The Jorge has a brain tumor. That's maybe the reason Jorge fell from the stairs. He had this nail gun holding in the hand and shooting the nail into the brain. 7 nails. And then he had surgery to pull out each nail. He's very lucky. He's a miracle. And later they resected the tumor totally. And Jorge still remember his wife. And Jorge will have omelette for the breakfast each day. If you like my review, please click subscribe. More interesting cases is coming. Be happy, stay safe.